As an AHSN Network, we really took a long, hard look at ourselves in terms of what the diversity agenda meant to us, particularly with our role in terms of spreading innovation. And we recognise that although there's some fantastic work that the NHS is doing in terms of diversity within its workforce, no one's really looked at the importance of diversity within innovation. And we felt that we had a leadership role to play in that space. So what we've done is we've done a lot of work this year to really understand the business case behind why diversity and innovation is so important. Important in all sectors, but obviously equally important or just as important to us in the healthcare sector.
Diversity and innovation is important. When we think about people, our workforce, who they are, we're not mono people. We have different sexualities, we have different colours, different races, we have different ages, we have different abilities. We need to be thinking about that in itself being innovation. Equality, difference is innovation. Can we harness that? Can we retain our staff? Can we celebrate that difference in our staff? I think we can.
If you have a team that has just one member of that team that shares their ethnicity with the client or the patient, the entire team is 152% more likely to understand the needs of that client or patient. And that's against a more homogenous, undiverse team. I think that simple stat just shows us why it's important to ensure that if we're really trying to understand the needs of our population, and we're doing so from a position of ignorance, diversity plays such an important, or gives us such an important opportunity to just round out the experience, not just of the diverse members of the team, but also how that enriches everybody in the team to understand our population in a much more holistic fashion.
The NHS Confederation is for the first time prioritising diversity, equality and inclusion in its corporate strategy. We are one of 5 corporate priorities. We'll be looking at making sure our members get better at EDI, not accepting poor equalities practice, and we will be making sure we are supporting more diverse leaders through both the development of the BAME Leadership Network and the Women's Leadership Network. We want to ensure we've got more diverse leaders in the NHS.
So we've come up with a series of pledges which can be summarised into 3 areas of focus. We have a whole raft of pledges around our organisations. So simply put, are we showing best practice in the way that we recruit our staff, in the way that we look to ensure that we're representative of the communities that we serve?
So I'm backing the ASHN's healthcare initiative to promote diverse innovators, because I believe innovators from diverse backgrounds based on their race, based on their gender, based on their ethnicity and culture provide a very different lens to the healthcare innovations that they're creating, which is really needed not only for the NHS and the UK healthcare system, but also when thinking about global healthcare interventions that can be implemented and created in our digital healthcare era.
And then there's also a number of pledges around our work and our impact. I think this is particularly important because innovation has the potential to both increase or reduce inequalities. And we have to ensure that the kinds of programmes that we're championing and helping to spread throughout the UK are ones that have been shown by the impact equality assessments that we're going to do to be positive in terms of their impact on reducing inequalities for our population.